Hello, everyone. Happy American Heart Health Month from the Health Promotion Disease Prevention team. Today, we'll be sharing more on how to use a home blood pressure monitor to accurately measure your blood pressure. Monitoring your blood pressure at home may be especially useful for anyone diagnosed with high blood pressure or hypertension. It can also be useful for individuals who are starting a high blood pressure treatment just to determine its overall effectiveness. And it's also useful for those who do require closer monitoring, especially individuals with high risk factors for high blood pressure. The American Heart Association and other organizations recommend home monitoring for all people who have a high blood pressure diagnosis. And this is to help the healthcare provider or their doctor determine whether treatments are working. Remember that home monitoring your blood pressure does not substitute for regular visits to see your doctor. Checking your blood pressure is an important part of managing a high blood pressure diagnosis, and monitoring your blood pressure at home can help with an early diagnosis. So self-monitoring can help your doctor diagnose high blood pressure earlier than if you had only had those occasional readings in your actual medical office clinic. Home monitoring is especially important if you do have elevated blood pressure or another condition that may contribute to high blood pressure, such as diabetes or kidney complications. It can help track your treatment. So the only way to know whether a lifestyle change or medication is working is to check your blood pressure regularly. And monitoring blood pressure changes at home can help you and your doctor make decisions about your treatment. It overall can encourage better self-control. So self-monitoring can give a stronger sense of responsibility for you and your health, and you may feel even more motivated to control your blood pressure. No matter what type of home blood pressure monitor you choose, proper use requires both training and practice. Most pharmacies, medical supply stores, and even some websites do sell home blood pressure monitors. An automatic or electronic device is what's recommended. And of course, you can discuss these options and choices with your doctor, so you pick the monitor that is best for you. Before using your monitor for the first time, you'll want to have a healthcare professional check its accuracy and watch you using the device to make sure you're using it properly. It's important to remember to be still, resting quietly and comfortably before measuring your blood pressure. You want to avoid smoking, drinking caffeinated beverages, or exercising within 30 minutes before measuring your blood pressure. You will want to empty your bladder beforehand, as a full bladder can increase blood pressure slightly. After you've rested calmly for about 5 minutes, you're ready to take your blood pressure. You'll want to make sure you're sitting correctly. You'll want to sit nice, tall, and upright with your back straight and supported. You want to avoid sitting on a sofa or cushioned furniture. Your feet should be nice and flat on the floor with your legs uncrossed. Your arm should be supported on a flat surface, such as a table, at heart level. Make sure the bottom of the cuff is placed directly above the bend of the elbow. Fasten the cuff tight enough so you can slide 2 fingers underneath it. Remember to place the cuff on bare skin, not over clothing. You can check your monitor's instructions for an illustration of how to use the monitor properly, and always check with your healthcare provider. You will want to try to attempt to measure your blood pressure twice a day, both in the morning as well as the late afternoon. And you want to try to take it at about the same time every day. It's best to take the readings daily. However, ideally, beginning 2 weeks after a change in treatment and during the week before your next appointment. Each time you measure your blood pressure, you can take 2 or 3 readings 1 minute apart and record the results. If your monitor has a built-in memory to store your readings, you can take the monitor with you to your appointments. Some monitors have the option that allows you to upload your readings to a secure website after you register your profile and make an account. Some people record their blood pressure readings by hand, for example, using a paper log, like you can see in the picture on the right. If you have an electronic personal health record, you may choose to record your information using a computer or your mobile device smartphone. This gives you the option of sharing your readings with your healthcare provider and family members, and some blood pressure monitors upload this data automatically for you. Just as a refresher, blood pressure is written as 2 numbers. The top number is the systolic number, which is the pressure when your heart beats. The bottom number is referred to as the diastolic number, which is the pressure when your heart rests between beats. Normal blood pressure is below 120/80. If you're an adult, high blood pressure is a systolic pressure of 130 or higher, or a diastolic pressure of 80 or higher. That stays high over time. A single high reading is not an immediate cause for alarm. Blood pressure varies throughout the day, and readings are often a little higher in the morning. Also, your blood pressure might be slightly lower at home versus if you were getting it taken in a healthcare clinic or medical office. If you get a reading that is slightly or moderately higher than normal, you can take your blood pressure a few more times and consult your healthcare provider to verify if there's a health concern or whether there may be an issue with your monitor. If your blood pressure reading suddenly does exceed 180/120, wait about 5 minutes and try taking it again. If your readings are unusually high, you will want to contact your doctor immediately. This could be signs of a hypertensive crisis. Thank you for tuning in, and please join us for virtual tabling every Tuesday and Thursday on Facebook at 11 a.m. If you have a home blood pressure monitor, you can feel free to have your healthcare provider see if you're using it correctly, or contact your clinic to see if you can come in and have a healthcare professional take a look at it. You'll want to plan to bring your monitor into your healthcare clinic once a year to make sure the readings are accurate. And if you are interested in seeing if a home blood pressure monitor and self-management program is right for you, please reach out to our Health Promotion Disease Prevention team. You can give us a call directly at 414-316-5011. Thank you.